Great. All right. So this is one of my favorite slides. I call this the three-tier system. It's something I've come up with, introduced to me by one of my old clinical supervisors. I've got a little bit of a picture I got AI to generate for me. So the three-tier system, these are your red flags, and it determines where you're going to take care of your patients. So you should always always approach all your patients with the three-tier system. So the first set of questions you want to ask are questions that if they were to answer yes to, you are going to send this patient to hospital today. So urgent hospital admission questions first. All right. So your sepsis, your strokes, your MIs, anything that requires the same day hospital admission. Answer those questions first. If they need hospital admission, make that decision. That's what you're doing. None of the other tiers matter. Okay. So if they don't need hospital admission, we go on to the next tier. Do they fulfill any criteria for malignancy or an urgent referral? So within the next 2 weeks or within the next couple of days to be seen in our patient setting potentially, but not for the same day admission. So that would be your second tier. And if it fulfills that criteria, of course, go along those lines and do that. If none of those first two criteria are fulfilled, then we deal with everything else. That's when we manage things in the community. We have a reasonable or realistic time frame in which to follow up the condition. We're using time as a diagnostic tool. We might use a trial of treatment, and we're going to see what the outcome is off the back of it. But we don't think the other two criteria have been fulfilled. So we're not doing any of the other things. So that's our three-tier system, and I encourage you all to use it with all your patients and start thinking along those lines, because it'll really help you make clinical decisions a lot quicker. So everyone should have seen this. All right, everyone should be very, very familiar with. So I'm not going to go through it in great details, but essentially it's a traffic light system. You can find this, of course, in your Oxford Handbook of Primary Care, but it's really important, guys, that you know and you're asking the questions for high risk or the red and the amber criteria, because we're not asking all of these questions. We're not demonstrating to the examiner that we're doing a thorough assessment remotely. Okay, don't forget this exam is testing us how we're assessing someone remotely, not somebody sat in front of you. So you need to be asking all the right questions. Otherwise, you're not demonstrating to the examiner that you can keep this patient safe. And your colleagues might be asking these questions and scoring higher marks. And that might be one of the reasons why people don't pass the exam, because your colleagues are asking questions that you are not, and there's something that you are missing here. And it might be that you use your clinical instincts in day-to-day life and you keep people safe, but this exam is all about demonstrating your work, just like all our documentations, all exams, etc. So you have to be demonstrating exactly what you're thinking, how you're assessing, what you ruled out, what else needs to be ruled out, and where you're going with your management plan with this. Great. So let's talk about the pediatric curriculum. I'm just going to check the chat to just make sure that everyone's been seeing that fine. There was a question. How do you access resources? Okay, great. So everyone's been seeing my slides. That's fine. So the link should be in the chat. And if you guys can't see it, please let me know. I'll post it again. All right. So let's talk about the RTTP curriculum when it comes to children and young people. So, of course, we know that it's a key area of education. There's lots of challenges that are emerging, but the Royal College wants to point out that mental health, drugs, alcohol, and safeguarding issues are becoming much more common. But lots of social determinants for health are particularly becoming more relevant for us to look at. So, unfortunately, rising incidence of child poverty, inequality, and of course, it's important for us to engage to reduce the inequality in access to services, etc.